Hi everyone, I'm Dr. Karishma Kagodu, board certified plastic surgeon, and we are at Dr. Karishma Aesthetics. Today I'm going to discuss to you about the recovery of gynecomastia. Now, most of the patients who come to my clinic are always concerned about how will the gynecomastia surgery be, what is the recovery time, how long will I take to heal. So to answer all of these questions, today I'm going to briefly tell you how it all works. Well, just so you don't have any surprises when you go in for the surgery, all of these tips and details that I give you today will help you understand how your recovery is going to be. Now, when you come for a gynecomastia surgery, first and foremost, I will have to examine you, examine the chest and see what grade of gynecomastia do you have. The gynecomastia is divided into various grades from grade 1 to grade 4 depending upon the severity of your condition. In grade 1, you may have a very small gland with probably little bit of fatty tissue or no fatty tissue at all, and you may not have excess skin on the chest. And as we reach increasing severity to the grade 4, you may see that you have not only a very big gland, but you may be experiencing excess skin or sagging skin in the chest along with the excess gland. So we will examine you, then we will send you for a chest ultrasound, and this ultrasound will tell you how much of fatty tissue or gland tissue is there. And based on the grade of gynecomastia, then I will decide which procedure for you is ideal. Now, the common types of gynecomastia surgery is usually liposuction, a gland excision, or a combination. You don't have to worry about the recovery. Gynecomastia surgery is one of the simplest procedures done in plastic surgery, and it is a daycare procedure. It takes only about 30 to 45 minutes. If it is just a liposuction, if there is some amount of gland tissue removal involved along with removal of excess skin on the chest, then the procedure may take about 1 to 2 hours. This procedure is usually done under general anesthesia. At times, if it is a very small gland, then we can also do it under local anesthesia combined with sedation. Now, after the procedure, there will be about 4 to 5 days of initial discomfort and pain. We do provide you with antibiotics, pain medications to relieve that pain and discomfort. These pain medications will not only help to reduce the pain, but also help in the swelling. Along with this, you will have to wear a compression garment, and this garment is like a waistcoat and it is worn for about 4 to 6 weeks. This compression garment is extremely essential to reduce the swelling, reduce the pain, and most importantly, give you the final shape of the chest. When we do a gynecomastia surgery, you can go back to your daily routine within the second or third day. If you are going to work to an office, you can start by the 4th or 5th day. The first 1 or 2 days is when the pain would be at its height and it would be most discomforting, so you may not be able to go to office. Well, in the 4th or 5th day, you can definitely go to your office. The healing time is about 10 to 14 days. In case a gland removal has been done and you have small stitches at the areola, all of these stitches will be inside the skin, so there's no need for stitch removal. If we have done a liposuction, then you have 2 small keyhole incisions usually made underneath the armpit or at the side of the chest wall. Now, these little cuts will not have any stitches and they automatically close on themselves by the 4th or 5th day. You may experience a little bit of oozing of fluid and fat coming from these holes for the first 2-3 days, following which the holes close by themselves and the oozing also stops. The next most common sign and symptom that we see after gynecomastia is swelling, bruising at the chest area. So there are few people whose skin is such that they have a more bruising tendency than another person. Bruising and swelling is commonly seen, lasts for about 2 to 3 weeks and starts subsiding on its own. We provide you with certain topical creams which will help to reduce the bruising as fast as possible. So going through briefly the recovery period of gynecomastia, it is a 1-day procedure, takes about 1 to 2 hours. You can go home the same day after the procedure. You will be provided with certain medications for 4 to 5 days. You will have certain pain and discomfort for the first few days. You can get back to your normal house routine activities, by the second or third day, you can start doing your activities from home. Say you're working from home, you can start by the third day. If you are going to office, you can start by the fourth or fifth day. Most times people ask me, when can I get back to my gym activities, when I can start my sports? Well, you can start walking from the next day itself. For the first few days, we advise walking for about 20 to 30 minutes. Try to be as active as possible. Do all your daily activities. After 1 week, we tell you to get into light gymming exercises. You can start with lighter weights, see how the pain and the swelling is. If you are able to tolerate it, you can go in for high intensity workouts. There's absolutely no restriction on physical activities. There is no restriction on you traveling. If you want to travel after the surgery, within the third or fourth day, you can plan a travel also, but you will be wearing your compression garment for 4 weeks. That compression garment is usually worn day as well as in the night time for the first 4 weeks. Maybe you can give a break of about a few hours in the daytime. So in general, we advise 18 to 19 hours in 24 hours for you to wear your compression garment. This is the most crucial part. The last and most important things is something called as lymphatic massages. Now, lymphatic massaging is done after any liposuction procedure. And in gynecomastia, we usually always do a liposuction of the chest in 90% of the cases. Now, when we do this liposuction with a high frequency ultrasound device like the Vaser that I use, the heat is creating a scar underneath the skin, and because of this, you will always feel some sort of a skin hardness. And this hardness is common to everyone, and this lymphatic massaging, which we start for you at the 7th to the 10th day, will help in relieving all these skin lumps, will reduce the hardness in the skin, and will slowly soften up your skin within 1 to 2 months. This massaging is extremely essential. Initially, we may send you to a professional physiotherapist to do this lymphatic massaging. If you have figured on how to do the massaging yourself, you can do manual massages yourself at home. But the first 1 month is very crucial for you to do these massages on a daily basis to help soften out the skin and even out the skin on the chest.